Hi guys, welcome back to Skincare Sunday. Dr. L here at Vital Med Spa. Today's topic is redness in our skin. So this has been a commonly requested topic I haven't touched on yet. We're going to delve all about why do we develop excessive redness and how do we treat it. So there are many reasons you can be excessively red. But I want to really go into that chronic inflammatory redness prone skin. Super sensitive. And it's not necessarily diagnosed as rosacea. Oftentimes people don't really see anyone for it and get the diagnosis, but it is a condition where the skin is red, inflamed, easily triggered, easily sensitized, commonly in these areas here, the nose, the cheeks, the forehead, and the chin. It can be very genetic, so a lot of people have family members with rosacea or redness as well, but oftentimes it can just arise out of nowhere. So if you notice that you have a lot of excessive redness in response to things like alcohol, temperature changes, exercise, and it remains red and may actually stay red at baseline, you may have some inflammation going on. So what are some triggers for redness and inflammation in the skin? We know the underlying problem is oil production causing inflammation and blood vessel dilation. Oftentimes those blood vessels can remain dilated and break open over time if the inflammation is not treated. And you can even develop nodules and deformation of the skin. Dead skin buildup is pretty common. I see it a lot here and here and here, where the skin is really dry and dull and the skin is not turning over or being exfoliated. And that's a dysfunction of that process of chronic inflammation on the skin surface. Some of the triggers for rosacea, let's talk about those. So triggers for redness include heat. So if you want to start controlling your redness at home, you want to address the amount of heat that is reaching your skin, whether it's the temperature of the water in the shower or when you wash your face and do your skincare, heat from the car, from indoor heat. Alcohol consumption can be a trigger, especially in excessive amounts where the blood vessels dilate in the face. Exercise, so you want to try to keep the temperature in your face at an all-time low when you're exercising using fans or other things, just so you don't trigger this excessive inflammation and redness and blood vessel dilation. You still want to exercise because it's great for your body, so I don't want you guys to stop doing that, but you can kind of blunt the effect of the heat generated in your skin when you exercise. Sun exposure. I want to go into this topic a little bit more with you guys. So we know the sun is bad for us in so many reasons, and aging being the primary reason that we're concerned about. But redness and triggering blood vessel dilation and the breakage of blood vessels is something that does occur from sun exposure. So you want to minimize sun exposure, whether you're caring about aging or you're caring about redness in your skin. Also, the heat generated by the sun on our skin does trigger redness as well. You want to use an SPF that is medical grade that can block the effect of the heat of the sun, not just the UV rays of the sun. So our medical grade sunscreens from ZL block the effect of heat for 12 hours, as well as blocking UV light for 1 to 2 hours. And then you need to reapply. So that's a great thing to do and change your lifestyle to take control of your redness. Now let's talk a little bit more about treatments and skincare and how do we treat redness and inflammation in the skin. So we start the process with our getting skin ready steps. So using a cleanser, an exfoliant, and a toner to remove that dull dead skin, the buildup of oil on the surface that is causing inflammation. That process alone becomes something that will decrease inflammation with time and improve the skin. It is a little bit drying and sensitizing in the beginning to our patients who deal with red sensitized skin, but over time your skin will become more resilient and improved by doing those simple steps. Then there's products that will decrease inflammation and make the skin more resilient and strengthen that skin barrier function that is oftentimes dysfunctional in redness and inflammation. I think of it as the skin fighting a war. It's inflamed, it's red, it's constantly being bombarded by the environment. So we want to strengthen that barrier function and help stabilize your skin so you're not so sensitive. Let's talk a little bit more about treatments. So you want to start decreasing the production of oil that is causing that chronic inflammatory redness and sensitization. And that process initially can be a little bit rough. Your skin is going to be a little more dry and peely and a little bit more red in the beginning. But as the skin adjusts, it's actually going to be stronger for it. You're going to have more resilient and more tolerant skin that is not going to be so perturbed by every little stimulus. Oftentimes, my patients with redness will simply touch their face and they're turning bright red. So we want to decrease that sensitivity and stabilize the skin. You may never not have a little bit of a red undertone, but we can certainly manage it and improve it dramatically and decrease those complications that come with long-term chronic inflamed skin. I also want to talk to you about the aging effect of inflammation in our skin. So if the skin is fighting this chronic inflammatory red process on the surface, it's also aging it. The skin cell turnover cycle is being dysfunctioned. The collagen production process is not happening correctly. All the things that are damaging the skin are going to be damaging it more when it's inflamed and it's sort of like weakened. So it's super important to manage inflammation. And like I said, this is a chronic process, so you want to continue to work on your skin if you have this tendency towards redness and inflammation to keep the skin healthy long term and allow it to remain as youthful and vibrant as possible. All right, that is all for Skincare Sunday. If you guys have redness and inflammation and its tendency towards sensitized skin, I'm happy to do a consult and help tailor both your skincare, your lifestyle, and in-office treatments to improve the skin. Take care.